Hello, good afternoon, good evening, and good morning to everyone joining to our today's session, Ask WHO. We are focusing on COVID-19 and other vaccines. I am very pleased to be joined by Dr. Kate O'Brien, who I'm sure you already know. Kate is our Director for Immunization, Vaccines, and Biologicals, and she will be answering your questions. So if you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, please use the comment section. Unfortunately, we have some technical issues with streaming on LinkedIn today. So please, for those who are normally following us on LinkedIn, we may not be able to be there today. Good afternoon, Kate. Thank you for your time.
Great to be here with you again.
And Happy New Year. We haven't had you in this 2023 yet.
Happy New Year to everybody. Let it be a healthy and happy, productive year.
Yes, and also for those who are still thinking about their New Year's resolution, we did have some campaign and advising people to keep up to date with their vaccination, COVID and other ones, right?
So important, and I'm sure we'll get to a lot of the issues about why people should do that, why people should check their vaccination status of themselves, their loved ones, and make sure that you're up to date with your vaccines. They're life-saving, they are protecting.
Thank you so much, Kate. And speaking of COVID, we are in the fourth year of the pandemic, and still we know that thousands of people are dying. And vaccines are one of the key tools to prevent those deaths. So can you please give an update to our viewers? Where are we with vaccination rates and where are the highest gaps?
So gosh, we're in such a different place than we were in 2020 or 2021 or even 2022. So at this point, there are over 13 billion doses of COVID vaccine that have been deployed to people around the world. And COVID vaccines, we have many COVID vaccines now. There is ample supply to meet the needs of every community, every person, every country. And the vaccines are working. All of the vaccines are protecting people against hospitalization, against severe disease, and against death. When people are vaccinated with a primary series, the first couple of doses of vaccine, and then are boosted with a dose of vaccine, that gives people the best protection possible. And if it's been some time since you've been boosted with your vaccine, it's time to get boosted again. We'll get into more details about the schedule. But what's so important is that people, especially who are at risk of having those significant severe outcomes from a COVID infection, really need to be vaccinated. And it's not only about whether you've been vaccinated, it's about when you've been vaccinated and how many doses you've had, so that the vaccines which we have can give their best protection possible for your health.
Thank you so much, Kate. And I think we'll go into those vaccine schedules more in detail. We are seeing a lot of questions as well in terms of vaccine efficacy, because we're still using the vaccines in most of the countries around the world that were produced a few years ago now. So are these initially approved vaccines still effective? And do we know how long their immunity lasts?
Yeah, so, as I mentioned before, we have a number of vaccines out on the market being used in countries around the world. Some countries have multiple products. And you'll all sort of remember that we have vaccines that are using different approaches to have those vaccines. So we have some mRNA vaccines. We have some vaccines that are based on the proteins of the virus. We have other vaccines that are based on the virus itself, a deactivated form of the virus. So a number of different what we call platforms of vaccines. All of these vaccines continue to show very, very good performance and protection against that significant serious end of the disease spectrum. And there are a couple of products that are out there that include the strain that was the original strain of the SARS-CoV-2 virus, but also components of the newly circulating strains, the Omicron strain. And those are called the bivalent products, bi meaning two and valent meaning two types of the virus. Those vaccines have shown that they produce a good immune response and are being used in many countries. We don't yet have evidence about the degree to which those vaccines are better than the vaccines that contain only one of the strains. But what we do know is that whichever vaccine that you take, it gives very strong protection against those significant disease manifestations from COVID. So what we're really urging people is what's most important is that you actually get vaccinated, that you have the right number of doses, and that you're up to date on your schedule.
Thank you so much, Kate. Here's a question from one of our viewers, which I think it's what is written here is, if someone is exposed with COVID positive patient but does not have any symptoms, is this individual eligible for a booster? And I believe this, if you are a contact, is this the right time to have a vaccine or a booster dose?
Yeah, there's no reason not to go and get your booster dose. So the only reason that you wouldn't get a booster dose as a result of contact with somebody is if you're sick yourself. And again, the only reason not to get immunized at that time is, number one, you're not feeling well. We probably don't want you to be coming out to a clinic or to a pharmacy or wherever you would get your doses and exposing other people. So if you're sick, take the time to recover from your illness, but certainly get boosted. If it's merely a question of you were in contact with somebody else who's sick and you're perfectly fine, there's no reason why you shouldn't go ahead and get your booster dose.
Thank you, Kate. Here's another question from one of our viewers on Facebook. I've been reading more news about vaccine and antivirals affecting your heart. What research do you have to share?
So for each of the vaccines, in fact, all vaccines, but we're talking specifically about COVID vaccines, because vaccines are given to people who are otherwise healthy. In other words, we're giving them to prevent disease. You don't actually have the disease that we're vaccinating against. Safety is one of the most important criteria for a vaccine to actually come to authorization by the committees that authorize vaccines in every country. And we continue to monitor safety for all vaccines throughout the whole ongoing period when vaccines are given. We never stop monitoring safety. And I'll just give an analogy to that. When you think about cars or airplanes, there's always a safety program that is continuously looking at safety information and trying to continuously improve on the safety concerns. If something goes wrong, what was the thing that went wrong, and figuring out how to avert that in the future. So the fact that we have ongoing safety evaluations is absolutely the right thing. We have safety evaluations of our food sources. We have safety evaluations of many things that we use in our lives on a daily basis. So we have an ongoing safety program. All countries have ongoing safety programs to look at vaccines. And we know that for some of the vaccines, there have been some heart-related issues. And for the mRNA vaccines in young men, there has been a signal, rarely identified, particularly in young men, but not only in young men, of inflammation of the heart. It's generally mild, it recovers, no consequences in the long term. But we've also been hearing in the social media and in the lay press a lot of concern about other cardiovascular events, and particularly in older adults, and a concern about stroke in older adults who having received some of the vaccines. Now, I want to explain what happens in these safety evaluation programs. We're looking at absolutely anything that is reported by somebody. We don't know, and the person doesn't know whether it was associated with the vaccine or not. So these safety reporting systems will accept any report that is made by any individual. It doesn't have to be verified that it had anything to do with the vaccine. So for instance, somebody could report, I'll give a little bit of a sort of absurd analogy, but somebody could report that they were in a car accident after the vaccine. They felt it was related to the vaccine. That report is accepted into the system, and the system will look at reports and identify whether there's anything happening in that big monitoring system that looks like it should be looked into further. So one of the things that happened in one system is that there was a little bit of a signal like, maybe there's something happening with more reports of some events in older adults. That's been looked into. It's not being seen in other reporting systems. So we call that a signal. It just means, we need to go look a little deeper into something. And this has not been verified in any other system, and it will continue to be watched. But I think that's the concern that people have had. And the information across a number of systems is that periodically something will flag up. It gets looked into more deeply. There has not been any verification of it. And so hopefully that addresses people's concerns.
Thank you so much, Kate. We've also seen some conversations on social media that deaths are also linked to COVID vaccines. So could you please comment on that as well?
This has been, really concerning misinformation. I think one thing that we'll start with is that when you consider how many people around the world have been vaccinated, anything that happens to people who have been vaccinated should not be attributed to their vaccination. When you have upwards of nearly 70% of the global population that's been vaccinated, it's really important to recognize that bad things do happen to people, and they are not related to vaccination just because something bad happened and somebody happened to be vaccinated. It's really, really clear that these vaccines are saving lives. Over 20 million deaths were avoided because of vaccination just in the first year alone. So I really want to caution people about these social media reports that are linking terrible, unfortunate things that have happened to especially young athletes, but really it could be anybody that something terrible happens to. Just because that person was vaccinated does not link the vaccine as having contributed to or related to somebody's negative health event or to, in the extreme case, to a death. So it's extremely important that people are getting information from accurate, credible sources, and that these individual attributions are really not something that has any credibility to it.
Thank you so much, Kate. And this was really important to clarify. Indeed, there's so much misinformation on this subject. You mentioned as well that we have safety systems in place. So maybe we can also clarify to viewers how those safety systems work. Are side effects or those negative events that people are reporting coming directly to WHO? Or if not, how those are collected?
So the safety reporting systems are national reporting systems. Every country has a safety reporting system. As I mentioned before, most of these systems, anybody can issue a report into the system. And then that, sort of big collection of information is analyzed on a regular, ongoing basis, a rolling basis. Those safety databases are looked at continuously. The manufacturers of vaccines are responsible for the safety of their products, and they have their own systems also that they are monitoring. So we have a number of different systems, so many country systems, manufacturer reporting systems that they are required to be reporting safety signals by the regulators in every country around the world. WHO works with all of these countries with their reporting systems, and we look at the information all together. So it's sort of this aggregation of information. So millions and millions of pieces of data that are looked at on a continuous basis. And I just want to emphasize that when we talk about a signal, it means that on the baseline of all of these things that are sort of being looked at, the vast majority of which have nothing to do with actually a receipt of the vaccine. Occasionally we will see a sort of increase in the number of reports of something specific, and that's what we call a signal. It doesn't mean that it's associated with the vaccine, what it means is we need to take a deeper look at that particular thing and go into a little bit deeper assessment of whether or not it has anything to do with the vaccine. The vast majority of the time, when a signal comes up and it's investigated specifically for whether or not it has anything to do with the vaccine, the vast majority of the time, we realize it has nothing to do with it. It was a random event, and it goes away.
Thank you so much, Kate. And through those systems of safety, we were able to pick up some side effects that vaccines have. So maybe we can remind viewers or clarify what are the most common side effects of COVID vaccines.
Sure. So the most common thing that we find in terms of side effects are mild, self-resolving side effects. These have to do with redness at the injection site, certainly pain at the injection site, discomfort, which usually resolves in a couple of days. Sometimes there's swelling at the injection site as well, and there might be a little bit of heat at the injection site. So these are largely local side effects that people have that self-resolve. Some people have fever. Some people don't feel very well for a day or two. And those are the most common things. Headache is another one that people experience. So these are all side effects that are generally mild. They generally can be managed with just local over-the-counter medications and resolve over a 1 to 2, sometimes a 3-day period. I recently had another dose of vaccine, and I had quite a reaction locally with some redness, some swelling. Took about 4 or 5 days to resolve, perfectly fine afterwards. So those are really the most important, most common side effects. Very manageable.
Thank you so much. Kate, here's a question from Deborah, who is watching us on Twitter. I got very sick with the third vaccine. I have artery problems and I'm afraid to do another one. So maybe we can comment on that as well.
Yeah, it's hard to give personal specific advice. I'm not sure what you mean by getting very sick after a vaccine. But if people do have concerns about the response that they had following a vaccine, and they're concerned about whether or not they should be getting another dose, really best to consult with your healthcare provider, your physician, your nurse, potentially a pharmacist, to get specific advice. In general, what I'd like to say is the kinds of reactions that people have for one dose don't predict whether or not you're going to have those local reactions or a couple of days of not feeling well with another dose. So we don't have an experience from one dose sort of previewing what will happen with the next dose. If people have had a serious reaction, which are extremely rare, that is definitely cause for discussing with a healthcare provider how to move forward.
Thank you so much, Kate. Here is another question, I think, from someone watching us on Facebook. How do you explain the current relationship between countries with higher COVID-19 inoculation rates and higher excess mortality, as well as countries with lower COVID-19 inoculation rates with lower excess mortality?
So I'm not sure what you're referring to in terms of COVID-specific mortality, because what we do see is actually the opposite, which is countries that have high vaccination rates and have pursued policies around containing the COVID. Really high vaccination rates are associated with reduced mortality. I think the exception that we're seeing now is when waves of disease come through. It really matters who has been vaccinated and when they were vaccinated. So we're seeing what is happening in China right now, where the vaccination rates are very high in China, but when you look at the vaccination rates of the most at risk, the older adults, they are not at the level of vaccination that can avoid a lot of serious disease in that age group, especially given the enormous efforts that are now being put in place by in China to assure that all older adults have full vaccination coverage, including of their booster doses. So it really matters when you've been vaccinated, and it matters which groups have been vaccinated, and especially those most at risk. For those who are vaccinated, again, very high protection. It's not 100% protection. There's no vaccine that provides 100% protection, but we need to be very careful not to mix up information about waves of disease that come through and how that relates to who has been vaccinated, when they've been vaccinated, and making sort of errors in attributing vaccination rates low and high to what's happening with disease.
Thank you so much, Kate. We have next question from a viewer on Facebook who lives in New York and is 73 years old. And he says, I had the Pfizer bivalent vaccine in September 2022, which means that I had had 5 Pfizer vaccines. Since it will soon be 6 months since that vaccine, it has waned. I don't feel protected, especially going to a doctor's appointment. Is there a possibility of getting another vaccine? This is just one example, but we have received a couple of questions in terms of how many booster doses and when we should, or how often we should take them. So maybe we can clarify that.
Yeah. So from first of all, the most important thing is that you should follow your national guidelines. Every country has a set of policies about how they will manage in terms of a vaccine schedule. The second thing to say is that from a WHO perspective, we have provided a recommendation about older adults receiving primary series doses and a first and second booster. We are continuing to look at the data about for how long those booster doses continue to provide the highest protection possible, and when and how frequently booster doses should be administered. This is an area that I would say is an area that is still somewhat unsettled science. We're continuing to watch the data that's coming out on how frequently those at high risk should continue to be boosted. Now, some countries have provided recommendations to go ahead and continue boosting on this regular basis, but I want to also give some context. It also matters what's happening in your community, what season it is, what your risk factors are also for actually being exposed and getting COVID. And there are things that people can do to reduce their exposure. And there are things, we also know that in communities there are waves of disease that come through. So it's not a blanket proposal or a blanket recommendation for every country, in every part of the country, in every person. Really providing this, for this kind of question about how many boosters, how often to continue boosting. That's an area that we don't have a recommendation from WHO at this point, but we will continue watching that evidence. We do know, let me just add one thing, Alex, is that we do know that for the Omicron variants that are circulating, it's extremely important to get your first booster. And we can see in the data around the world that there's virtually no country where the booster coverage is as high as the primary series coverage. So we're still quite some distance from all people who should be getting a booster actually getting it. The second thing is when you get your first booster, it improves the performance of the vaccine above and beyond what was achieved by the primary series. The purpose of the second booster is to return that performance after there is some waning over time. And so that's really the purpose of second and potentially third or fourth boosters, is to address the reduction, the somewhat reduction that happens over time.
Thank you so much, Kate. And some of our viewers were asking about frequency of getting those booster doses. How much time should be in between?
So in between, first of all, the primary series and the booster, and then the time between the first booster and the second booster, we are recommending about a 4 to 6 month period. Now that choice of whether it's 4 or whether it's 6 months, again, I'll come back to some of those contextual factors. What's happening in your community? What are your exposures? What are your plans for socializing, perhaps being at some events where there will be a lot of people present? I also want to comment on, we get a question a lot about what if I've had COVID recently? Should I delay the booster? And again, there is some immune protection as a result of being infected, having disease. And so we also point to the possibility of waiting after you've been infected for a period of approximately 4 to 6 months.
Thank you so much, Kate. Here is a question from Fanella Kelly Simpson, I think also watching us on Facebook. Do vaccines wear off quickly? And is that why we have to get the booster shots?
Yeah, so the first booster is, as I mentioned before, is actually gives improved protection above and beyond the protection that you get with the primary series. That's why we just keep saying it over and over again. A full vaccination series is a primary series plus a booster. That gives the maximum performance of the vaccines that we have right now against these variants. Now, over time, and when I say time, I mean over a period of about 6 months, there is some reduction in that performance. It's not extreme for the protection against the serious side of the disease spectrum, but it does happen, it does go down. And that's why WHO recommends that for those people who are at significant risk of disease, a second booster is our recommendation in order to return the performance of the vaccines to where they were after the first booster. How long does it take for that waning to happen? Again, we're looking at a period of about 6 months, and that's why our recommendation is that the second booster would be given approximately 6 months after the first booster for those who are at significant risk of disease.
Thank you so much, Kate. Here is a question from Saru Takuri. What are the things that need to be considered when you have a person interested to receive bivalent booster who has already completed 2 doses of primary series of vaccine and 2 other booster doses?
So there's kind of 2 things mixed up in this question. One is about getting multiple booster doses. And, I think we talked about that already. We have a recommendation about the first and the second booster. We're continuing to collect the data, watch the data on the need for and the performance of getting a third booster. And for some people, they're moving on to third or fourth boosters. I think that we're probably headed in a direction of providing a recommendation as this virus is becoming, it's not a virus that's going to go away. We're going to have to live with this virus for an indefinite future. And so I think we're probably headed in a direction for countries to have a policy that may be around using booster doses on an annual basis for high-risk individuals, possibly more frequently for some of the high-risk categories. But that's probably the direction that we're headed in, similar to the influenza vaccine recommendation, to get the influenza vaccine before the influenza season on an annual basis. But the second part of the question was around the bivalent vaccines. And I'll just reinforce that the bivalent vaccines are working. We have really nice evidence that has come out about the performance of those vaccines. But what we don't have is evidence on whether a bivalent vaccine for a given dose is better than let's call it the regular vaccine. And so we continue to look forward to that kind of evidence. Pretty difficult to collect it at this point. So what our recommendation is getting a booster is important, and getting it from any of the vaccines that are offered. It doesn't have to be the bivalent product.
Thank you, Kate. Here's another question on mix and matching the vaccines. What mix of vaccines give the strongest protection, or keeping it to only one brand? AstraZeneca 3 times or AstraZeneca 2 doses plus Pfizer 1 dose?
Yes, we have so many vaccines on the market now. They fall into these 4 categories, these 4 platforms or types of vaccines. So there are inactivated vaccines, there are protein adjuvanted vaccines, there are viral vector vaccines, and there are mRNA vaccines. And those are 4 technical terms, and people don't need to know exactly which platform their vaccine is of. What we do know is these combinations of vaccines, so having one dose with one product and another dose with another product, in general, the mix and match schedules actually have some benefit to them over staying with the same vaccine for all of the doses. So our recommendation is that you can get a series that includes the same kind of vaccine for each of the doses that you get, if that's what you're most comfortable with. However, there does seem to be some benefit, some immune benefit from doing mixing and matching. So people shouldn't be concerned or nervous about mixing and matching and optimizing the vaccines. Again, we're still in a phase where it's a little bit hard to say exactly what the best schedule is of these vaccines. And the best vaccine schedule is a schedule where you actually get the vaccines.
Thank you so much, Kate. Here's another question, and I think this is a good bridge to move a little bit away from COVID vaccines. Is WHO seeing more vaccine-preventable deaths in children since all focus is on COVID-19 immunization?
Well, I really want to emphasize this. We have had a historic backsliding in the routine immunization of children and adolescents. This has resulted in 2021 over 25 million children around the world who didn't receive even one dose of vaccine through the routine immunization program. Those 25 million are on top of the almost 20 million the year before, and those 20 million are on top of the over 13 million the year before that. So there are an accumulating number, over 50 million children over the past few years who haven't even received not even one dose of vaccine against pneumonia, diarrhea, and measles in particular. So this is really heading into a crisis situation where it's extremely important for children who missed their vaccines to get caught up on those vaccines. We are seeing increased numbers of deaths. Of course, that's happening. We have measles outbreaks that are occurring around the world, yellow fever outbreaks, diphtheria outbreaks. So we have many outbreaks of disease that are completely preventable diseases, as you know, if those children had been vaccinated. So in 2023, we are calling for a year of catch-up of all of those people who missed their vaccines, of recovery of the immunization programs so that they're performing at the same level before we even went into the pandemic, and of strengthening, of accelerating, because even before we were in the pandemic, there were still over 10 million children who missed every single dose of vaccine that was available in the country. This is causing completely preventable deaths, and that's unethical, immoral, and unacceptable.
Thank you so much, Kate. And you're mentioning a few different outbreaks. Which preventable disease outbreaks are you concerned the most about at the moment?
Our biggest concern is around the measles outbreaks. Measles is one of the most transmissible viruses. We've all become very familiar with how commonly the COVID virus moves from one person to the next. Measles is many-fold more infectious than that. So for every case of measles that exposes people who are not immune, who have not been vaccinated, there's somewhere between 12 and 20 additional people who will get measles. Highly infectious virus. And as a result of that, we need over 95% of children to be vaccinated against measles in order to stop it. Many countries around the world have stopped measles. In other words, there is no transmission of measles in the country. This is possible. Many countries have achieved this, but there are still too many countries where measles is causing serious disease, causing death. And with all of these additional children who missed out on their measles vaccine, this is the year to catch them all up.
Thank you, Kate. And maybe we can also clarify, are children the most vulnerable to measles?
So yes, well, it's not only children. We see measles outbreaks that happen in adolescents, young adults. Anybody who is not immune to measles is at risk from getting measles. So it can happen to anybody, but most of the people who are at risk, of course, are children, young children, infants, young children. And the kinds of things that happen to them when they get measles, it's not just the measles event. What happens after you get measles is the immune system of that child is actually altered for a period of months and ongoing years. And children who have had measles continue to be at risk, increased risk of other infections that are life-threatening, such as pneumonia, diarrhea, and other infections. Even after they've recovered from their measles event, their immune system is not the same immune system that they had before they had measles. So this is an ongoing risk for children who have measles. It's not a one-time event that they recover from. I think the second thing to say is we're also in a food crisis in many countries. With the economic crisis, with famine in some countries, we see increased, many-fold increases in children who have malnutrition in some countries. And this combination of malnutrition and measles is a deadly combination for children.
Thank you, Kate. This is really worrisome, what we're seeing across the world, and we have safe vaccines for measles. Maybe we can also remind viewers and parents when is the right time and which vaccine they should give to their children.
Yes, so countries generally have a schedule of deploying measles vaccine, giving measles vaccine to children that is usually between 9 months of age and somewhere around 15 months of age. Each country has a slightly different schedule. Measles vaccine is given in combination with a vaccine against rubella, and in some countries also against mumps, so that's the MMR vaccine. Different countries may give measles vaccine alone or measles and rubella vaccine. Measles is an incredibly safe vaccine. It's a life-saving vaccine. Again, the kinds of side effects from measles vaccine, usually vaccinated in the leg, because these are young children as opposed to the arm, redness, a child may feel some discomfort, so they might not be moving their leg quite the same way as they did, because as you know, when you get it injected in your arm, you sort of don't move it quite as much because it hurts when you do so. May have some fever for a few days. So those are self-resolving, the kinds of side effects that people see from measles vaccine.
Thank you, Kate. And we're also seeing increased hesitancy, not only on measles vaccine, or COVID vaccines, it's overall. So what is WHO doing to address it?
So vaccine hesitancy, listen, it's something that people have concerns about vaccines. People want to know that the vaccines are safe. They want to know what the schedule is. They want to know what the vaccines are for, and they want information about the vaccines. Those are, I have great respect for people who have an interest and want to be sure that what they're being recommended has been evaluated well and is safe to take. Those are really sensible things for parents to ask questions about, and that's really different. Vaccine hesitancy, where you're asking questions, is very, very different from people who are anti-vaccine or vaccine misinformation coming out, information that is knowingly false. These are two really different things. What we see most of all when we work with countries is most of the reason why parents are hesitant about vaccines has actually to do with lack of access. It's not convenient for them to get vaccines, or it is the services that they receive are not services that are of a quality that how the services are actually deployed, and the time and the place with the explanations that they're asking for. So we're working with countries. We're certainly really emphasizing the quality of the services that are provided, so that when people come to get vaccinations, they're given all the services that they need, and that they have a really good experience when they're coming for vaccination. The other thing is that people really want to have information, and I want to urge people to get your information from credible sources, the WHO website, your national websites. There's a lot of misinformation out there, and people have to be really savvy users of social media information, because there is so much information that is simply incorrect. It's false information, and it's information that is harming people because it's influencing people not to be vaccinated. Vaccines are life-saving products, and it's a tragedy, in fact, when people have chosen not to be vaccinated on the basis of information that is factually incorrect information.
Thank you so much, Kate. And I also just remembered that January is also Awareness Month on cervical cancer. And one of the best ways to prevent cervical cancer is also HPV vaccination. So maybe you can also remind our viewers about that.
Yes, so HPV vaccine is a vaccine against cervical cancer. It's given to both girls and to boys in some countries. Cervical cancer is one of the most tragic diseases that it affects families. It affects women still in the prime of their life, and it takes away these women from their families. So HPV vaccine is an incredibly safe vaccine. It's incredibly effective. And we have a new recommendation from WHO based on the evidence that we've reviewed that even a single dose of HPV vaccine is highly protective against getting the HPV virus strains that are the cause of most cases of cervical cancer. Unfortunately, at this point, only about 15% of the girls around the world who should be vaccinated are vaccinated. So we are launching, along with partners in UNICEF and Gavi, a renewal, a re-energization of our support to countries to introduce HPV vaccine and to catch up those millions and millions of girls who have not yet benefited from vaccine. So now is the time for HPV vaccine to really do what it can do to protect the lives of women.
Thank you so much, Kate. And maybe just before we end, you were talking about the importance of access to information and credible information. And I think that COVID has changed a little bit of that dynamic as well, how we ask information. We've seen so many public conversations, including on social media, vaccine from this producer or this type or the other type, which one is better, etc. And that may be translating now into other vaccines. So is there a place where people can see which vaccines were approved by WHO or regulatory bodies so that maybe they can be reassured which vaccine they should get?
Yes, so on our WHO website, and I don't know, Alex, if we can pop it up there, but we do have listings of the vaccines that are pre-qualified by WHO for COVID vaccines, the emergency use listed vaccines, and you can look up on your national regulatory authorities the vaccines that are authorized in your country. There are many producers of vaccines, and there's information on your country websites, on WHO's websites, about each of these vaccines. I just really want to emphasize the importance of people knowing their immunization status. I think as adults now, it's going through COVID, this is probably the first time that adults themselves, most of us, are really attuned to what our own immunization status is. And many of these diseases are ones that we've all been vaccinated against as children. These are vaccines that are safe, they're life-saving, and every child, every adolescent, every pregnant woman, every older adult deserves the right to be protected in the best way possible.
Thank you, Kate. This was a great conversation, and I'm sure our viewers also found it helpful. There were great questions, so I thank everyone who joined us today, and I invite them to stay with us, following us on our social media channels and webpage, where we are updating with these new initiatives as well to re-energize and motivate either new programs or to catch up with existing programs on immunization. Maybe last message from you before we close?
Well, first of all, I just want to, for everybody who's been listening, I just really want to wish you a really healthy 2023. I also really want to emphasize that the tools are at our disposal. There is a famous quote about vaccines, that a vaccine that stays on the shelf is not a life-saving vaccine. The only thing that actually saves lives from vaccines are people who have been immunized. So I really want to just re-emphasize that it's not only about getting vaccinated, it's about when you've been vaccinated and having the right schedule. And so all of that information is available to you, and we'll do whatever we can to help assure that you're getting done what you need to do in 2023.
Thank you so much, Kate, and thanks everyone for joining us today. Stay safe. Goodbye.